truly said that nurses are a unique kind. They have this insatiable need to care for others, which is both their greatest strength and fatal flaw. Well, my name is Karuna Singh. Welcome to the channel Knowledge Star Continuous Knowledge Excellence. Namaste. Today we have a very special guest who is professor and principal at Sparsh College of Nursing, Bangalore, India. Please welcome Dr. I. Clement. Welcome, sir.
Good morning, ma'am. Good morning to one and all.
How are you, sir?
Good, ma'am. Good. So it's nice to meeting you again this year. Wish you happy new year to one and all. The complete team of Consortium E-Learning Network Private Limited.
Wishing you the
And
same.
also
Thank you very much, sir. Wishing you the same. Thank you so much. We will start with the very first question, that is, what is medical surgical nursing?
yes, ma'am. Before going to your question, actually, I would like to say brief about the nursing. How many nurses are working in India? According to the Indian Nursing Council records, and it's around 33.41 lakhs of nurses, registered nurses are working in India and abroad. And India, still we have a shortage for nurses. Means according to the WHO statistics, the India stands at 1.7 nurses per thousand population. As per WHO, it's supposed to be 3 nurses per thousand population. So we have a huge shortage of nurses. And I would like to congratulate the Indian nurses. They have given a special service during this COVID time. So it's a big salute for each and everybody. So coming to your question, medical surgical nursing. So medical surgical nursing is the ocean in the nursing field, and which includes the medical problems, surgical problems, and also nursing perspectives. The 3 triangle, which is focusing on providing the best quality care to the patients. So this is a medical surgical nursing is a single largest nursing specialty. Applying nursing process means nursing process having a series of steps. By applying one to the other, the quality care will be delivered to the patients. And the nursing care taken by the prioritization, assessment, and communication skills and leadership qualities, this collaborative nursing care given to the patients. Means it's the complete team is the nurse work with a complete team and provides the best care for the patients. And this medical surgical nursing it involves in the various setups like hospitals, in a hospital, inpatient, outpatient department. And also the nurses are working in a various setups. As you know that like schools, school health nurse, and in the factory, and various areas in a research perspective, the nurses are working in various setups. So medical surgical nursing is applied in each and every perspectives. And also now the new technology, we are going to discuss later about this, the trends, telenursing, which has come from the telemedicine. The wonderful opportunity has given to provide the best care for the general public. Is it okay, ma'am?
Absolutely, sir. Absolutely. Okay, I have heard one term, that is OET, Occupational English Test. What does it mean and what is it?
So it is a OET. Now commonly we can hear this word. It is specialized, means it's a specific English language test for a operational English test that is called OET. And this is mainly focused for the healthcare workers. Healthcare workers, especially like every health professional needs to be, the English speaking environment should be appropriate to everybody to make that this OET test is made, and it is specially prepared for the healthcare providers. And when we say IELTS, which is a common actually for all the professionals, but when you say about OET, it is only for the healthcare workers. And also there is a minimum score of 350 for listening, reading, and speaking. And also subtest will be there. And 300 score, minimum score in a writing subtest will be given in this OET. And ILTS test, when we compare with the OET and ILTS, and it is ILTS is a overall ability to communicate the English language. Yes, ma'am.
Okay, then what are the recent advancements in the field of nursing?
So when we say advancement, now the technology has made so much advancement. You can see like mobile phone, there are everything, even blood pressure, oxygen saturation, and hemoglobin. All those things through help of mobile apps, we can read the values actually. So technology has brought into the highest level, means sophisticated situation. Now every person needs to have a user technology. So this technology is used not only in nursing education, it is also in a service. So when I discuss about the education, we can see that like simulated learning means the nursing procedures or skills are learned, means explained and taught by using a simulation method of teaching. So the real before they go to the practice on the human being, they will be training more and more to get a excellence performance learning when they learn through simulated learning actually. And also we have a examination called OSCE, and it's a means objective structural clinical examination, means the same setup, the students are examined.
Wait. Are you worried about your project, training, dissertation, internship? Don't think too much because Nanoscience and Technology Consortium, in short NSTC, is giving you a golden opportunity to do the same tasks. NSTC also conducts workshops on amazing topics. So if you want to register in the workshop, the registration link is given in the description box below, or you may go to the website www.nanoschool.in where you can easily enroll in the workshops. So just check it out right now.
Their skill will be tested, and once they are learned the skill properly, they will be allowed to touch the patients or care for the patients or do any type of nursing procedures. So coming to the nursing service, so technology has made huge contribution, and especially like advanced equipments like automated IV pumps and portable monitors, smart beds and wearable devices and electronic health records and centralized command centers and health apps. And also we have telenursing, home care nursing, and emergency care, and all those things like because of the technology and because of the need of current need of the global, and we are so advanced. The trend is keep changing each and every day. The technology means it is used for diagnosis and therapeutic purposes. So it's both contributed in education and service. Because of the technology, there are a lot of changes has come, and the nurses are like updating their knowledge to cope up and to provide the quality care.
Okay.
Yes, ma'am.
Sir, initially you said that there is a shortage of nurses, right?
Yes.
So can you please tell me the reason behind that? What could be the reason?
Because every nurses are means when the nurses are trained here and they started migrating because of the better salary and because of the better lifestyle, and people once then graduated from here and they want to move to the abroad, especially like western countries. So this also one of the reason for nurses shortage in India. And there are other reasons also I would like to tell that like because of the government setup, or means the government which is providing a salary and shortage of nurses and everything is happening in India. So this is like migration is one of the main reason for nurses shortage also, we can say. Yes, ma'am.
Okay, so according to you, What changes should be made by the government?
So the government means we have seen like the huge shortage in the COVID situation in COVID-19. We have seen like how the shortage has happened, and still we are facing the problems actually because it's maybe due to the shortage of nurses in India or migration to other countries. And India should be really needs to be taken care of nurses, especially in terms of increasing the staff in the government hospitals and primary health centers. And also, the salary needs to be improvised. And there are the major problem is now you can see that like contract workers. So they should be taken, they should be absorbed by the government, and they should be employment needs to be given, and they can be utilized by the government actually. Now the big problem is coming like government temporary employees and the means the permanent employees. So this can be taken care by the government of officials. And also the opportunities for the nurses for the betterment of learning skills like CNE can be conducted, and there are a lot of training and development can be given, and research activities can be included for the nurses. And these are activities which really help for the nurses to do a better and the best service for the public. And also some of the career opportunities I would like to include here. And as you know that nursing is like from sky to earth, and everywhere and every profession the nurses are involved now. We can school and factories and army, military nurses are there, and research and infection control. In the hospital itself, there are various specialities are there. In that, nurses are involved in all the areas, and nurses are working as a teachers, especially like training and nurses, like different categories again, like professors and associate professors, lecturers, and clinical instructors, and various teaching roles also they are playing. And other than that, now we can see that like there are some of the few emerging issues like nurse practitioner in critical care areas. So this is a 2-year master degree program and organized by Indian Nursing Council and approved by Government of India. So this will be the booming, and this will be the one of the best, and which will be like giving you this critical care nursing practice also like it's included in midwifery also, like nurse practitioner midwifery course also it's coming now. And the nurse anesthetist course, anesthetist program, it is there are few fellowship programs like oncology fellowship programs are organized right now. And also like there will be a nurse practitioner course which is helping for the nurse to make their own clinic, and they can provide the best care. It's already now the government of India has given an approval for community health officers. They are directly in a rural setup, they are providing the best quality care for the patients. And also the maternal health officers, there's another program which is held by Government of India. Maternal health officers are working everywhere to provide the providing for the general public. So these are the some of the few advancement or the career opportunities which is happened in nursing.
Okay, one question is arising in my mind. That is Karnataka government taking any action regarding this?
Yes, ma'am. Definitely, there will be each and every step the Karnataka government is taking care of nurses, especially like in terms of like appointing the nurses and providing the welfare for the nurses. But still, lot of things it's a challenge actually. Still, it can be further development and further facilities can be provided for the nurses. But here in Karnataka, all the nurses are like they are well environment for working environment is given by the government of Karnataka.
Okay, so last but not the least, many colleges I have seen that don't give much importance to the professional communication. If I talk about the nursing department, right? So according to you, what is the importance of a professional communication in terms of nursing?
Definitely, as you say, that professional communication is most important because communication skill is one of the major primary skill in nursing. Because every nurse is not only working with the patients, and she or he is dealing with the complete entire team actually. So the knowledge and the quality service can be delivered only by the learning about the communication skills. So every institution, the first day when they join to the nursing course, especially nursing students, and they need to be trained with communication skills. This INC syllabus has included this communication syllabus in the first year, actually. So English and communication is one of the main subject which is given here in the new syllabus. It's INC has applied a new syllabus, right? Revised a new syllabus this year, actually. So like what happened, like when they teach communications, they can be more interactive with everybody in a healthcare team, and also they will be gaining a confidence to communicate each and everybody, so thereby they can provide a quality care to the patients.
Absolutely. So, thank you very much, sir, for this wonderful interaction. Further, I would like to tell you about one of our products, that is APID, which stands for Academic Profile Identity. It is an innovative academic platform designed for the researchers, scholars, students, and faculty members. So, to register in that or to visit APID, you can go to the link, that is apid.journalslibrary.com. So, thank you very much, sir. Thanks for this wonderful interaction. Thanks a lot.
Thank you, ma'am. Thank you.
For more updates, subscribe to our channel, click the links shown on the screen to stay connected.